Hello, everyone. I am Dr. Paul Gilbert. I'm a professor at San Diego State University, and I'm also the chair of the psychology department. Hope you're all well. I hope you're staying safe and healthy at this time. So what I want to do today is take a few minutes to talk to you about the field of neuropsychology. So I'm going to switch over now and share my screen so you can see some slides I've developed. I'm also going to mute my video so you don't have to look at me through this whole lecture. All right, so let's talk for a few minutes. What exactly is neuropsychology? So what you're seeing here in this picture, this is what neuropsychologists do. They sit down with the patient and they give them some of the tests we're going to learn about today. The point of this is really to assess this patient's abilities, their cognitive abilities to remember, to pay attention, to produce language, and other cognitive features. So before we get into what neuropsychology is, I want to talk for a second about what it is not. Neuropsychology is not neuroscience. So neuroscience is a very big evolving field. Often neuroscience research focuses on animal models such as rats or perhaps primates. They might focus on a cellular level. That's not what we do in neuropsychology. It also does not require neuroimaging. Things like fMRI, for example, are wonderful cognitive neuroscience tools, but they're not neuropsychology. Neuropsychology is a study of the effects of brain damage or disease on behavior and specifically on cognition. So in the field of neuropsychology, we use tests like you see down here in this picture in the corner to assess someone's cognitive abilities after they've had brain damage or maybe had some kind of disease that has affected their brain. So we always use human participants in neuropsychology research. And clinical neuropsychologists who see patients in clinical settings obviously are seeing human patients. Neuropsychology, which most people do not know, is a clinical discipline. To become a clinical neuropsychologist, you need to graduate from a clinical psychology PhD program and have an emphasis or a track in neuropsychology. Now, one thing I always tell students when they tell me they're interested in becoming a clinical neuropsychologist is it is one of the most competitive subfields of psychology. In fact, it might be one of the most competitive fields out there for graduate programs. Most people who successfully get into a clinical neuropsychology program have high GPA, high GRE scores, and some other things we'll talk about later when we talk about getting into a program. So students often ask, what's a typical graduate school experience like? And what I'm about to say is true for basically any clinical PhD program, but I'm going to specifically kind of focus on a clinical neuropsychology PhD program. So when you start a program in clinical psychology, for the first 3 years, you spend a lot of time in coursework. And as a clinical psychologist, you need to be very broadly trained and take a breadth of courses. You'll take courses in social psychology, you'll take courses in biological psychology, with a primary focus in coursework in clinical psychology. So that's during your first 3 years. As you get past your 3rd year, the amount of courses you take actually starts to drop off each year, to where usually in your final program of the year, you're really only taking maybe a course or maybe not even any courses at all during your final year in the program. So in addition to coursework in graduate school, now by the way, students often ask, how many years would I expect to be in a graduate program to get a PhD in clinical neuropsychology? You'd probably be in that program for about 4 to 5 years. Now, during the program, in addition to coursework, you're also doing what we call clinical practica. This is when you're actually in a clinic, you're seeing patients and learning how to be a clinical psychologist. Each year, usually beginning your 2nd year, you do a practica. So you wind up with a total of about 3 to 4 practica during your program. Now, not every clinic you're going to be working in is a clinical neuropsychology clinic. You need to be trained in a breadth of different aspects of clinical psychology. So you'll be trained in therapy as well as clinical neuropsychological assessment. So oftentimes in the 2nd year to 3rd year of your program, you'll also complete a master's thesis. Some programs call this a senior project. So this is usually where you'll do some kind of a research project, or you might write up a literature review or a case conceptualization, and you'll present that to your master's thesis committee. And when you pass that, you'll actually earn a master's along your way to a doctoral program. Now, I should step back and clarify one thing. Some people go into a doctoral program straight in, and they'll do a master's along the way to getting their PhD. Other students will do a master's program and then transition to a PhD program. Sometimes doing a master's program first will cut off some of the courses you take in a doctoral program. They might waive your need to do a second master's in the doctoral program, and sometimes not. We might talk a little bit more about that later. So after your master's thesis is earned, then students often have to complete what we call comprehensive exams. And this is a set of either written or oral exams you take before becoming a doctoral candidate. So once you pass your master's thesis, pass these exams, then you're officially a doctoral candidate. And then you start to explore what you want to do for your dissertation. So your dissertation is usually the research project you complete to earn your PhD in clinical psychology. So once you come up with an idea and you work with your faculty advisor to come up with that idea, then you present that in something called a dissertation proposal. You'll write up a proposal of what you want to do. You'll present that to a committee of faculty members, and they will read your proposal, and then you'll have an oral proposal where you'll go in and explain what you want to do. They'll ask you questions, and at the end of that, hopefully it's successful, and they'll say, okay, great, now go do that study. So then you collect your data, you write up your actual dissertation, complete the written project, you send that back to your same committee, they evaluate it, and then you hold your dissertation defense. And during this, you'll talk about what you did, what you found, what it means, and answer questions from your dissertation committee. Now, a lot of students think, okay, great, now I've passed my dissertation, I'm finished, but that's true in other PhD programs, but not in clinical psychology. To actually get your PhD in clinical psychology, after you defend your dissertation, you then have to complete a clinical internship. And this is a one-year internship where you're working in a clinic or a hospital setting, full-time essentially, seeing patients. And at the end of that year, if you complete your internship, you've completed your dissertation defense, then you actually earn your PhD in clinical psychology. So you can see this might take up to 6 years, 5 years in your program and a 1-year internship. So when you're going into this, you got to really be prepared for this to be a 6-year endeavor. Now, once you get your PhD in clinical neuropsychology, you can do a lot of different things with that degree. Some people decide, like what I wanted to do through my entire graduate training, was become a professor. And so a lot of clinical neuropsychologists will become professors. There's a lot of things you can do as a professor as a clinical neuropsychologist. One of those is teaching. My favorite part of my job actually is teaching undergraduate courses. I absolutely love teaching students. And I've taught up until this year the neuropsychology course here at SDSU. So you can teach courses to graduate students or to graduate students, undergraduate students or graduate students. Sorry if I said that wrong. And you can also do clinical supervision. So as a clinical neuropsychologist or a clinical psychology professor in general, you can supervise students in a clinical setting who are learning to also be clinical psychologists. That's another aspect of teaching. You can also do research. For example, I'll talk a little bit at the end of this. I do research in the neuropsychology of aging and neurodegenerative diseases. And you also usually wind up doing some combination of these two things, teaching and conducting research as a professor of clinical psychology. So some people will get their clinical psychology PhD and emphasize in neuropsychology or not, it applies in both situations, and instead they don't want to be a professor, they want to be a clinician. They want to work in a hospital medical setting, they want to see patients and bill for their services. So in this case, after you complete your internship, students will, PhDs will often go on to complete board certification, which is another round of tests you complete to become what we call board certified. You then will want to get your license. So you have to get a license for the state in which you're going to work to be a licensed eligible clinical psychologist. Mostly what you do in clinical neuropsychology is assessment. Give patients these tests that we're going to learn about in just a second. You can see one of the tests over here. We'll talk about this test in a moment. This is the Tower of London test. And these tests will assess their ability to do certain cognitive, test their cognitive abilities. A lot of people who become clinical neuropsychologists work in hospitals, others work in clinics, some work in community agencies, and some work in private practice or consultation. Now, another question I get a lot is how much can someone make as a clinical neuropsychologist? And as you might guess, it varies greatly. Clinical neuropsychology is a pretty good paying field. And even right out of graduate school, I know quite a few people who went out making near $100,000 to over $100,000 right out of graduate school in neuropsychology. And I know people who are making hundreds of thousands of dollars as practicing clinical neuropsychologists and as professors of neuropsychology. So it's a pretty in-demand degree, and it's one that you can make a decent living with. So what are some things that neuropsychologists study? Here is a list of different diseases or conditions studied by neuropsychologists. This is by no means comprehensive, just to give you some ideas. People study things like stroke and TBI, traumatic brain injury, Alzheimer's disease, autism, Huntington's disease, the cognitive effects of the HIV virus, ADHD, schizophrenia, visual disorders. These are things where people have problems visually recognizing objects, for example. Parkinson's disease, PTSD, brain tumors, epilepsy, in children, fetal alcohol syndrome, and also multiple sclerosis. So basically, if you look at all these disorders and conditions here on the screen, you'll notice all of them have some effect on cognition. That's what neuropsychologists would be doing, is studying those changes in cognition in these patients. Now, someone who's a practicing clinical neuropsychologist might be seeing these people for cognitive assessments and then writing reports on the person's cognitive abilities based on the findings from their clinical assessment. So what I want to do now is show an example of a couple of neuropsychological tests. These are just kind of fun exercises to kind of see what these tests are like. So I'm going to show you a screen on this in the next screen, and what I want you to do is to yourself, as quickly as you can, say the color in which each word is written. And go across the screen from left to right, just like you're reading on a page. And again, to yourself, say out loud as fast as you can the color in which the word is written, not the actual word itself. Ready? Go. Okay, so now you're probably thinking, wow, that's about the silliest thing I've ever seen in my life. That's just the word, the first condition. This next condition, I want you to do the exact same thing. Don't say the word, say the color in which the word is written. Ready? Go. So that's a little bit harder, isn't it? Now you might be saying this is actually a pretty interesting cognitive test. So you're noticing what you have to do. If you look at this first letter up here, the word up here on the left, this is actually the word red, but it's written in blue. So your brain automatically wants to say red, but you have to suppress red and actually say blue, the color in which red is written. So this is a test that's very dependent on the frontal lobes of your brain, that frontal cortical area. And you're having to pay attention to one thing and suppress another thing. So people with frontal lobe problems due to brain damage, a tumor, maybe a disease, have a hard time with this test completing it. So this next test I showed you on that very first picture is called the block design test. And this is a test that we find people have a hard time with when they have parietal lobe brain damage, so kind of on the sides and upper part of the brain, especially on the right side. And so how this test works is, if you look here where I'm circled my cursor, there's a sample card. And it shows a design in red and white, and you have some red and white blocks, and you basically need to take this card and use the blocks to make that exact same design. So you can see the gentleman's working on it here. And so basically you have to see the card, make sense of the card, and then be able to recreate the shape or the image using the blocks. This is called the block design test. And this is a visual spatial task. And again, very dependent on the parietal lobes. This next test, you might have seen this figure before, where I'm circling here with my cursor. This is called the Rey-Ostreth figure, or the Rey-O, R-E-Y-O test. And what you do with this test is you give the patient on a piece of paper this image you see here. It kind of looks like a funky spaceship. And you ask them to draw that image while looking at it. So just simply copying it. And so if you were to go about drawing this, just take a look at my cursor here. You'd probably start off by drawing the square first. Then you might draw the X in the middle. And then you might be going about drawing some of the details from there, like the nose cones, we call this here. Now, someone who has a problem with visual spatial perception might do something very differently. If you follow my cursor, this is how they might go about drawing it. Okay, you can see that's a very different way of going about drawing this figure. And this would show you what someone who has visual perceptual processing problems might have. There's one condition called simultagnosia, and it's kind of like looking through a drinking straw. And that's all the person can see is equivalent to what you would be able to see if you close one eye, held a drinking straw up to your eye, and that's kind of their whole world. So if you're trying to see this image, you would only see one little part at the time, and that's might be how you go about drawing this figure. So in the end, they may draw it pretty well, but the way they go about it is impaired. And so what you'll often do is have the person change colors of the ink they're drawing it in as they go, so you can track how they went about drawing it. So this is the patient's actual copy of that image. You can see these patients here both did a pretty good job copying it. This patient here, this is a control, a healthy person who draw it. This is what they would draw. So you see these patients with brain damage, their ability to copy this image is actually pretty good. What you see down here in the bottom where I'm circling is this patient's ability to draw it from memory. So after they copy it, you take it away, and you ask them to draw what they just saw from memory. This patient has memory problems because of their brain injury, wasn't able to draw anything. This patient here in the middle had memory problems, but they're not quite as severe. They at least remembered what sort of it looked like and drew part of it. And you can see here's what a healthy adult would draw from memory. You can see it's nearly perfect. Okay, so this is called the Ray-O design. Two parts of this test. Visual perceptual part, where you're just copying the image, and then also visual spatial memory component, where you're drawing it from memory. So here's a really challenging test. It's called the Wisconsin Card Sorting Test. And what you're looking at here, this woman in this cartoon is basically the patient. In front of her, she has a deck of cards. And on each card, there are different shapes, there are different colors, and there's a different number of shapes on each card. So in this case, it could be plus signs, circles, triangles, and a star. They could be either red, blue, green, or yellow. And there's either 1, 2, 3, or 4 items on each card. So the person starts off, and in front of them, they have 4 sample cards and then 4 trays. The person has a deck of cards in front of them. Your only instructions to the participant or the patient, depending if it's clinical research setting, is I'd like you to start sorting these cards, and I'm going to tell you if you put it in the right pile or the wrong pile by either saying correct or incorrect. So this patient here might sort this green one into a pile, and you say correct or incorrect. Now, before the patient starts sorting, you have a rule to which you want to sort them to. They either sort to color, to number, or to shape. So if the rule is to sort to color, the person would put this card in the green tray. If it was to shape, they'd put it in this tray here. If it's a number, they'd put it into this tray here. Sorry if you can hear my dogs barking in the background. I have 2 Chihuahuas that go crazy every time someone walks past the house. So sorry about that. So the person does not know the actual rule. So they start sorting the cards. Now, eventually they're going to start sorting and they'll get one right. You'll say, okay, that was correct. Say if it was to color and they put it here. And then they start saying, oh, okay, I know the rule. For each one, I need to sort according to color. So once you learn the rule, this next card in the deck would go here in the red pile. So what you do is you let the person continue sorting until they've made a certain number of correct sorts in a row. And you count how many it takes them to get to that number. And I won't tell you exactly what that number is, but there's a specific number. And then once they get to that number, then you change the rule on them. And now they might have to sort, instead of sorting the color, now they might have to sort according to shape. And so they put this one in this pile now. And then you see how many times it takes them sorting the cards to get that new rule down. So this test looks at 2 things. It looks at rule learning, then it looks at shifting from one rule to another rule. This is a very challenging test, again, for people who have frontal lobe damage. Very frontal lobe mediated test. And again, it's called the Wisconsin Card Sorting Test. And you just keep changing the rule every time they get a certain number of sorts correct and see how many times it takes them sorting the card to get to the next, to learn the next rule. Now, this next test that I want to take a second to talk about is one that was shown in a picture earlier in the lecture, and it's called the Tower of London test. And this is actually a 3-dimensional test. There's a board with 3 pegs on it, and then there's 3 discs on one of the pegs, and they're different colors and different diameters like you see here. There's a small red, a little bit bigger green, and a bigger blue. And then there's 3 pegs, peg A, B, and C. So to do this test, you say the goal of this is to get each one of these, to basically create this shape here, the image you see here, the red one on top, the green one on top, the blue one, but on peg C. A couple rules. You can only move 1 disc at a time, and you can never put a bigger disc on top of a smaller disc. So basically you have to move these one at a time and eventually re-stack them so that you get the blue, the green, and the red on post C. So if you thought about how you might go about solving this, you might take the red one and move it over to post C first. Take the green one, move it over to post B. Take the red one, move it back over to post B on top of the green one. Take the blue one over to C. Then move the red one back over to A, green one to C, and the red one over on top of that. So that's the way you would wind up with this image here. You can, again, pause if you'd like to and see how many moves you can do that in. And so basically you look to see how many moves it takes the person to recreate the shape over here. And you also look for errors. And if they make an error, you say, no, I'm sorry, that's an error. You can't do that. And they have to go back and go back to the last step and then not make an error. And again, this is a test that looks at planning, it looks at problem solving, and it looks at rules, because you have to pay attention to the rules. And this is a very, again, frontal lobe dependent test called the Tower of London test. So I hope that gives you an idea of just some of the tests that we use in neuropsychology. So I don't do clinical work in the field of neuropsychology. All the work I do is in the research realm, looking at the cognitive changes we see in patients as they get older and people develop neurodegenerative diseases like Alzheimer's and Huntington's disease. But again, these same tests are used in clinical settings to assess patients. So just very briefly, before we wrap up, just maybe tell you a little bit about what I do in the field of neuropsychology. So again, I mentioned earlier, I study the neuropsychology of aging and neurodegenerative disease. So I focus primarily on cognitive functioning, primarily on memory. I'm very interested in memory changes as people get older and as memory changes as people develop these neurodegenerative diseases. I also study executive function. Executive functioning is a group of cognitive skills that are mediated by the frontal lobes. And these are things like we talked about, planning, problem solving, rule learning as well. I use a lot of standardized neuropsychological tests we learned about today. And I don't do this as much anymore, but I've developed a lot of my own tests that measure aspects of cognition not measured by standardized tests. We also assess behavioral function in my lab as well. We need to look at mood, because we know, for example, if an older adult is highly depressed, they actually will show cognitive impairment. And we got to make sure that if we think they might be developing Alzheimer's disease, it's because of brain changes and not because of something such as depression. So we use standardized psychological tests to assess mood and anxiety. I also do some work in motor functioning. I study patients with Parkinson's and Huntington's disease who have motor problems. So we use neurological tests, and I also do some things like dynamic posturography, looking at balance, for example. Another thing I do in my lab is study instrumental activities of daily living. So these are basically tests that we do that measure real life cognition. Things like balancing your checkbook, for example, or doing online banking, managing one's medications. And we see how changes in neuropsychological functioning on these standardized tests might actually affect instrumental activities of daily living and how they might relate. So again, over here on the right column, just shows some different patient populations that I've studied and have studied. You can see there's quite a few different populations that I've looked at and published research on in my career. So that really wraps up my presentation on neuropsychology. Hope you now have a better feel for what neuropsychology is, and just as importantly, have a good idea for what neuropsychology is not. And if you are interested in the field of neuropsychology, I welcome you to reach out to me, maybe not in the next couple of weeks to months, because I'm a little busy with all the unfortunate things we're dealing with right now. But I'd be happy to talk to you about the field of neuropsychology and give you some advice for careers. So I hope you found this informative, and I hope you have a great rest of your semester. And again, let's just make the best out of what we're doing with this online education. I know you've got some great professors. Let's make the best of this situation. So thanks for listening.